Welcome back, everyone, to another deep dive.
Mm,
And today we're going to be tackling
okay.
assisted dying
No.
in England and
Yeah.
Wales. Um, and it's a subject that's been making waves over there
No doubt.
because Parliament recently voted on something called the Terminally Ill Adults End of Life Bill.
Mm.
So we're going to be looking at this bill
Right.
and kind of going over it a little bit.
Yeah.
And we're lucky enough to have this great article from the Lancet to help us kind of dissect it.
Okay.
But one thing that really kind of caught my attention right off the bat was that when they had the vote on this bill in the House of Commons,
Mm-hmm.
it was met with silence,
Oh, wow.
which is
Sorry.
really, really odd
Yeah.
for
Yeah.
such a
For a topic like
controversial topic. Yeah.
yeah, you'd expect some fireworks.
Yeah. So what do you think about that?
I mean, maybe the silence was just like a moment of reflection, given the gravity of the decision they're facing. Assisted dying, I mean, it's a tough topic.
Yeah.
It really touches on, I think, some of our deepest fears and beliefs
Right.
about life and death
Right.
and the role of medicine and all that.
Definitely.
Yeah.
And that's one of the things that we want to kind of look at
Yeah.
in this deep dive is, what this bill would mean for everyone involved,
Mm.
for the doctors, for the patients, for the whole healthcare system.
Yeah, for sure.
I guess the first thing we should do is try to understand what this bill actually proposes.
Okay.
So what does it say?
Well, this bill, the Terminally Ill Adults End of Life Bill,
Oh,
it would allow terminally ill adults with 6 months or less to live to request medical assistance in ending their lives.
okay. So it's very specific.
It is, yeah.
Maybe
It's not just anybody.
you can't just say like, oh, I want to end my life.
Exactly. There are very specific eligibility criteria
Yeah, and there are.
and a lot of safeguards to ensure that the patient's decision is informed and voluntary.
Safeguards. Yeah, what kind of safeguards are we talking about?
Well, for example, the bill requires 2 independent doctors
Okay.
and a high court judge
Wow.
to confirm that the patient's decision is voluntary and made with full understanding of what's involved.
So they're not messing around.
No, they're definitely not.
It's a pretty rigorous process.
It is.
And how does that...
It's a multi-layered approach
Okay.
that aims to minimize any potential for coercion or abuse.
That's not good.
Yeah.
Are there any other differences that you see like with this bill and say like the Oregon model?
Well, one notable distinction is the role of the doctor.
Okay.
So under this bill, the coordinating doctor would directly provide the lethal substance to the patient.
Oh, okay.
Whereas in Oregon, doctors prescribe the medication, but the patient ultimately administers it themselves.
Oh, interesting. So
That's
it's a bit of a different approach.
yeah, it's a key difference.
It is, yeah.
And what do you think about that? What are like some of the
Well, I mean, arguments for or against that?
yeah, it's a complex issue.
Mhm.
People who support this more direct approach, they argue that it's a more compassionate way to end a patient's suffering.
Okay.
Allowing the doctor to administer the medication ensures that the process is peaceful and controlled
Right.
and minimizes distress for both the patient and their loved ones.
Right.
On the other hand, though, some people, including some medical professionals,
Mm-hmm.
they find this level of involvement morally problematic.
Yeah. I could see
They
that.
worry that it blurs the line between caring for a patient
Right.
and intentionally ending their life,
Yeah.
which could have, profound implications for the doctor-patient relationship.
Yeah, no, that's a good point. And I'd like to explore that a little bit more. Like, what are some of the other ethical and practical challenges that doctors might face if this bill becomes law?
Right.
Like, how do you think this would?
Well, one major concern that's being raised is the potential strain on the National Health Service.
Oh.
Implementing assisted dying
Yeah.
would require significant resources.
Yeah.
Training for doctors,
Right.
setting up new protocols,
Yeah.
allocating funding.
Right.
Critics worry that this could divert resources away from other essential healthcare services,
Right.
especially at a time when the NHS is already facing immense pressure.
Yeah. So that's a valid concern.
Yeah.
So what kind of training do you think doctors would need?
Well, it would definitely require a whole new level of expertise.
Yeah.
I mean,
And
doctors would need training in palliative care,
okay.
mental health assessments, legal protocols
Wow.
to ensure they can properly evaluate a patient's request, identify any potential risks of coercion,
Right.
and provide appropriate counseling and support.
So it's a lot to ask.
It is.
Do you think?
And some critics worry that not all doctors would be prepared for this added responsibility.
Right. So what are some ways that we can make sure that doctors are prepared?
Well, that's a really crucial question, and it highlights the need for really robust training programs
Okay.
and ongoing support for healthcare professionals.
Mm-hmm.
Some people have suggested that maybe specialized teams could be created within the NHS,
Hmm.
composed of doctors, nurses, social workers, ethicists,
Oh,
who are specifically trained to handle assisted dying requests.
okay.
This approach could help ensure a higher level of expertise and emotional support for everyone involved.
Yeah, it seems like having a dedicated system might be able to kind of address those concerns about overwhelming doctors and even improve the quality of care
Potentially, yeah.
provided to patients.
Yeah.
But before we move on to the Oregon model, I want to go back to something you mentioned earlier.
Yeah.
You were talking about the accuracy of prognosis,
Right.
and you mentioned that patients must have 6 months or less to live.
Yes.
But how can doctors really be sure about that time frame?
Yeah, you've hit upon a crucial point.
It's a tough one.
It is, yeah.
And
Predicting life expectancy, especially for terminally ill patients.
yeah,
It's a complex and often imprecise science.
right.
Doctors can make educated estimates based on the patient's condition and medical history,
Mm-hmm.
but there's always a degree of uncertainty.
Right. I mean, we're dealing with humans, like make computers.
Right. It's not an exact science.
How does the bill propose to address this challenge of like the uncertainty?
Well, the bill does acknowledge this complexity,
Okay.
and it includes provisions for multiple medical opinions
Okay.
and thorough reviews of the patient's medical records.
Okay.
However, it remains a key area of debate, with some arguing for stricter guidelines
Mm-hmm.
and others advocating for more flexibility to account for the inherent uncertainties of medical prognosis.
This is a tough one.
It is.
Now, you mentioned earlier Oregon's Death with Dignity Act, which has been in effect for 25 years.
Yes.
And it's really valuable, I think, to kind of look at that
Yeah.
as an example of how assisted dying can work in practice. What are some things we can learn from Oregon's experience?
Well, one fascinating observation from Oregon is that a significant number of patients who obtain the lethal medication never actually take it,
Really?
which raises some intriguing questions about the psychology of facing death.
Yeah, what do you think that is?
Well, it's a question that has puzzled researchers and ethicists for years.
Hmm.
Some speculate that simply having the option, that knowledge that they have control over their final moments, it provides a sense of peace and agency,
Okay,
even if they ultimately choose to let nature take its course.
that's interesting.
It's a very personal decision
It is.
and a very complex one.
It is.
So, yeah, it's a fascinating aspect of this whole debate.
Yeah, it really makes you think
It does.
that assisted dying is not solely about ending life. It's also about
Right.
empowering people to
Uh-huh.
face death on their own terms.
Exactly. To have that sense of control and autonomy
Yeah.
at a time when they may feel most vulnerable.
Yeah. And that kind of brings us to this idea of palliative care.
Yes.
So,
So how does palliative care fit into this whole conversation?
yeah, how does it fit in?
It's an important part of the equation.
Yeah.
That's for sure. It is, and it's a really important aspect of end-of-life care.
Yeah.
And a lot of people aren't familiar with what it is.
So can you kind of explain what palliative care is?
Sure, yeah. So palliative care, it's a specialized medical approach that focuses on improving the quality of life for people with serious illnesses. It's about providing relief from pain and other distressing symptoms, as well as addressing the emotional, social, and spiritual needs of patients and their families.
Oh, okay, so it's not just like
Exactly. It takes a holistic approach.
yeah.
Really looking at the whole person,
Okay.
not just the disease.
Yeah.
Yeah.
And then how does palliative care kind of fit in with this whole
Yeah,
assisted dying conversation?
that's a great question. And it's one that's generating a lot of debate.
Okay.
Some people see assisted dying and palliative care as two completely separate paths, while others believe they can complement each other.
Mm-hmm.
The key thing to understand is that palliative care is about providing support and comfort throughout the course of a serious illness,
Mm-hmm.
regardless of whether a patient chooses assisted dying or not.
So it's about making sure that
It's about maximizing quality of life
quality of life, yeah.
for as long as possible,
Okay. That makes sense.
and addressing all aspects of suffering.
Right. But some people are worried that if this bill passes, it could have a negative impact on palliative care.
Right, yeah. There's a concern that legalizing assisted dying could shift resources and attention away from palliative care.
Okay, so,
If it's
assisted
simple,
dying becomes an option.
yeah,
Some worry that people might be less likely to seek out
okay.
or receive adequate palliative care services,
So it might overshadow it a bit,
potentially.
even though they can both be valuable.
Right, exactly. Options at the end of life.
They both have their place.
Yeah.
And
What about like the influence? Do you think it could influence people's decisions?
yeah, that's another concern, that the availability of assisted dying could subtly influence people's decisions,
Even if that's not
even if that's not the intention.
the intention.
Yeah, some people worry that patients might feel pressured to choose assisted dying,
Okay.
either from family members who are struggling with the burden of caregiving,
Okay.
or even from a healthcare system that might see assisted dying as a more cost-effective option
Oh, wow.
than long-term palliative care.
Yeah. I mean, that's pretty disturbing.
It's a valid concern,
It is.
and it's one that needs to be taken seriously.
So how do we make sure that it's truly like
Well, that's why the safeguards
choice?
That's why the safeguards outlined in the bill are so crucial.
Okay.
The requirement for multiple doctor consultations,
Yeah.
mental capacity assessments,
Mm-hmm.
and a high court judge's review
Yeah.
are all designed to protect vulnerable patients
Yeah.
and ensure their decisions are truly their own.
So they're really trying
They're trying to put in as many layers of protection as possible.
to minimize any
Yeah.
potential risks.
Minimize the risk.
Yeah.
Absolutely.
Okay. Well,
It's a delicate balance.
it is, yeah.
For sure.
And this whole issue has just so many
So many.
ethical and practical challenges.
That does.
So many layers to it.
Yeah.
But I want to kind of shift gears for a second and talk about the bigger picture.
Okay.
What does this debate say about how our society views death and dying?
This is where it gets really interesting, I think. This debate is really forcing us to confront some of our deepest fears and beliefs about death.
Mm-hmm.
For centuries, death has been a taboo subject in many cultures,
Right.
something to be avoided at all costs.
Right. Death is like this.
Exactly. We don't want to talk about it.
The big elephant in the room.
Yeah, but now
Now we're talking about it.
we're starting to see a shift.
Yeah.
There's a growing recognition that death is a natural part of life,
Okay.
and that sometimes, it can be a merciful release from unbearable suffering.
So this bill kind of represents that shift in thinking.
I think so, yeah. I think it reflects a movement away from the idea that death is always the enemy, something to be fought against
Right.
at all costs.
Yeah.
There's a growing acceptance that sometimes death can be a welcome relief.
Okay. I'm also struck by the emphasis on individual autonomy in this bill.
Mm-hmm.
Like the whole process seems designed to make sure that the patient's decision is truly their own.
Absolutely. There's a strong emphasis on informed consent and the right of individuals to make their own choices
Mm-hmm.
about their bodies and their lives, even when those choices involve ending their lives.
Yeah. Right.
It's about respecting their autonomy and their right to self-determination.
But isn't there a tension there? Like,
Yeah, there is.
on the one hand, we want to empower people to make these decisions for themselves,
Right.
but we also have to acknowledge that people are influenced. Absolutely. By their family.
Of course.
By their doctors.
A society?
Yeah, by
That's
society.
a complex web of influences.
It is. So
Yeah.
how do we balance that?
That's the question.
Yeah.
How do we balance individual autonomy with the need to protect vulnerable people from coercion or exploitation?
Mm-hmm.
And that's a tough one.
It is.
There's no easy answer,
No.
but it's a question that we have to grapple with.
Yeah, and it seems like they're trying to find that balance with this bill.
They're trying.
Yeah.
It's a work in progress, but the intent is there.
Yeah, they're trying to put those safeguards in place
It's
to
exactly.
minimize that risk.
Minimize the risk and make sure it's truly the individual's choice.
So this bill, it's really making waves, and it's sparking this nationwide conversation
It is.
about how we approach death and dying.
It's a conversation that needs to happen.
It does.
And I think it's a good thing that it's happening.
Yeah, and it's making me think about the doctor-patient relationship. How might that be affected?
Well, yeah, traditionally doctors have been seen as healers, right? People who fight to preserve life.
Right.
But this bill introduces the possibility of doctors playing a more active role in ending a patient's life.
And that's a big
That's a significant shift.
shift, yeah.
Yeah.
And how do you think that might affect the trust
Right.
between doctors and patients?
That's a crucial question. It's hard to say for sure, but it's something we need to consider carefully.
Mm-hmm.
Some people worry that it could create a sense of unease or distrust between doctors and patients, especially for those who are opposed to assisted dying on moral or religious grounds.
I can see that, but couldn't it also lead to more open and honest conversations?
It could, absolutely.
Oh.
If this bill becomes law, it could force us to have those difficult conversations that we often avoid.
Right.
It could encourage doctors to be more upfront with their patients about their prognosis
Yeah.
and to really explore all available options,
Right.
including palliative care and assisted dying. So it could lead to a more holistic approach
Yeah.
to end-of-life care.
Right. So it's not just
It's not just about one option or the other.
right. It's about
It's about having a range of options and choosing the one that's right for the individual patient.
right and having that open communication.
Exactly.
Since you're
Their
the
doctor. Open communication is key.
Yeah.
And this bill could potentially facilitate that.
And that could be a positive thing that comes out of this.
It could be.
Yeah.
It's certainly a possibility,
It is.
and it's one that's worth exploring further.
Yeah. This has been a really
It's a fascinating topic.
fascinating discussion so far.
It is.
We've covered so much
Yeah.
from the details of the bill to the
Mhm.
broader philosophical and societal implications.
Lots to think about.
There is.
That's for sure.
But before we wrap up, I want to go back to something we mentioned earlier,
Sure.
the Oregon model.
Right.
Can you remind us how this bill kind of compares to that?
Yeah, so the Oregon model, it's been really influential in shaping similar laws around the world.
Mm.
And this bill in England and Wales, it shares a lot of similarities with it.
Okay.
Both laws require patients to be terminally ill adults with 6 months or less to live.
Okay.
And both include really robust safeguards to ensure informed consent and protect against coercion.
Okay, so the safeguards.
The safeguards are very similar,
Okay.
but there's a key difference
Key difference.
in how the medication is provided.
Right.
So in Oregon, the doctor prescribes the lethal medication,
Mm-hmm.
but the patient ultimately takes it themselves.
Right.
Under this bill in England and Wales, the doctor would actually administer the medication
Right.
directly to the patient.
Yeah.
So that's a significant distinction.
It is. And what are the implications of that difference, and how do proponents and opponents of each approach
Right.
justify their position?
Well, proponents of the doctor-administered approach argue that it's more compassionate, ensures a peaceful and controlled death,
Mm.
and minimizes distress for the patient and their loved ones.
Really?
They emphasize the potential distress and uncertainty involved in self-administration, particularly if the patient's physical condition deteriorates.
Right.
So, they really prioritize a smooth and predictable process,
Okay.
minimizing the potential for complications or distress.
So they're thinking about
They're thinking about the practicalities of
Yeah.
the situation,
yeah,
as well as the emotional impact
the emotional impact.
on both
Okay.
the patient and their family.
Okay.
On the other hand, though, opponents of this approach, they express concerns about blurring the traditional role of the doctor.
Right.
They argue that directly administering a lethal substance fundamentally alters that doctor-patient relationship
Yeah.
and could undermine trust in the medical profession.
Really changes things.
It does.
Yeah.
It's a major shift,
It is.
and one that needs to be carefully considered. And they also worry that it could create a slippery slope,
Okay.
leading to less stringent safeguards
Okay.
and potential misuse of assisted dying.
So it's a
Valid concern.
It is a valid concern.
Yeah.
So both sides have their
We do?
arguments,
They do.
and it seems like that.
And both sides raise important points
It does.
that need to be part of the conversation
Right.
and the debate.
It's at the heart of
It's a complex issue.
this whole conversation.
It is.
Yeah, it really is.
So I've been talking about this for a while now,
Mm-hmm.
and I'm curious, how has the public reacted to this bill?
Well, it's a mixed bag, to be honest.
Okay.
Public opinion polls suggest growing support for assisted dying in England and Wales.
Okay.
But there are still significant pockets of opposition, often based on religious or moral beliefs.
Okay.
So it's not a clear-cut issue
No.
by any means.
And what about the medical community?
Yeah, within the medical community, there's a similar divide.
Some doctors strongly support assisted dying.
Mm-hmm.
They see it as a compassionate option for patients who are suffering.
Right.
Others are strongly opposed, often citing ethical or religious concerns.
Okay.
So it's a very personal issue,
So,
and one that evokes strong emotions on both sides.
yeah.
Yeah.
You mentioned earlier, Dignity and Dying and Doctors Association UK.
Right.
What are their stances?
Yeah, so Dignity in Dying is a leading advocacy group that's been campaigning for the legalization of assisted dying for a long time.
Okay.
They view the bill as a major step forward, arguing that it would provide choice and control
Okay.
for terminally ill patients who are suffering.
Mm-hmm.
And they've been really instrumental in raising awareness about assisted dying
Mm-hmm.
and mobilizing public support for the bill.
So they're trying to
They're definitely playing an active role.
get it passed.
Yes, absolutely.
And Doctors Association UK, what are they?
Doctors Association UK, they're a professional organization representing doctors and medical students, and they've expressed strong opposition to the bill.
And what are
Their main concern
concerns?
is that the bill would fundamentally alter the doctor-patient relationship,
Okay.
potentially eroding trust
So they think
and creating ethical dilemmas for physicians.
it could really change things.
It could.
Yeah.
It could have a profound impact
Okay.
on the way medicine is practiced
Okay.
and the way doctors and patients interact.
Okay, well, it sounds like this bill has really
It has.
got people fired up.
It has galvanized both supporters and opponents, leading to a really robust debate.
Yeah.
And I think that's a good thing.
And that's what we like here
Absolutely.
at this show.
It's important to have these conversations.
Yeah, it's about shining a light
It is.
on complex issues.
It's about encouraging people to think critically and engage in these meaningful dialogues
Yeah.
and challenge their own assumptions and consider different perspectives.
This one is definitely complex.
It is, yeah.
And it's got a lot of
Lots of layers.
layers to it, yeah.
For sure.
All right, well, let's dive a little deeper into the ethical arguments for and against assisted dying.
Sounds good to me.
Okay, so let's start with the arguments in favor.
All right.
Why do people believe that this should be a legal option?
Well, one of the most powerful arguments is the principle of autonomy.
Mm-hmm.
The idea that individuals should have the right to make decisions about their own bodies and lives,
Right.
including the timing and manner of their death.
Okay.
Proponents of assisted dying argue that denying terminally ill patients this choice is cruel and paternalistic,
Okay.
robbing them of their dignity and control at a time when they need it most.
So it's about giving them that.
It's about respecting their right to self-determination,
Right, to self-determination, yeah.
even in the face of death.
Okay.
It's about empowering them to make choices that align with their own values and beliefs.
Okay, and what about the compassion argument?
Right. Compassion is a big part of it, too. They argue that assisted dying is a merciful act that allows terminally ill patients to end their suffering and die peacefully on their own terms.
So it's about acknowledging that.
It's about recognizing that death can be a release
Yeah.
from unbearable pain and suffering,
And
that individuals should have the right to choose that release if they deem it necessary.
Okay, so that's the
So those are some of the main arguments
arguments in favor.
in favor.
What about the arguments against?
Right. So on the other side, one of those common objections is the sanctity of life principle.
Okay.
The belief that all human life is sacred
Okay.
and should be protected, regardless of age, health, or disability.
Mm-hmm.
Opponents of assisted dying argue that intentionally ending a life, even with the consent of the individual, violates this fundamental principle.
Mm-hmm.
They believe that it devalues human life and sets a dangerous precedent.
They're worried about
Yeah, they're worried about the slippery slope argument.
the slippery slope.
You know, where do we draw the line?
And what about, like, abuse?
Right. They also raise concerns about the potential for abuse and coercion.
Yeah.
They worry that vulnerable individuals, especially those who are elderly, disabled, or suffering from depression,
Okay.
could be pressured into choosing assisted dying,
Right.
even if they don't truly want it.
So again, it goes back to
That goes back to that question of autonomy
autonomy, yeah.
and making sure that the decision is truly voluntary.
Yeah, and also just like the impact on doctors.
Right. They also express concerns about the impact on the medical profession.
Mm-hmm.
You know, they argue that legalizing assisted dying would fundamentally alter the role of doctors,
Right.
blurring the line between healing and killing.
And that could be tough
It could be, yeah.
for a lot of doctors.
It could create moral distress for physicians who are opposed to assisted dying on conscientious grounds.
Yeah. I mean, it's hard because, like,
It's a tough one.
both sides have
It's a clash of values.
really valid points.
It is.
It really is.
But it's a clash of values and beliefs.
Yeah, it really comes down to that.
It does. And it's a
It-
conversation that we as a society need to have.
Yeah, we have to have this conversation.
Thoughtfully and respectfully.
And it's great that we are
It is.
having it.
And I think this bill is helping to facilitate that conversation.
Right. Okay, well, let's talk about the practical side of things.
Right.
We talked about the ethics, but, like, how would this actually work?
Yeah. That's a crucial question.
Mm-hmm.
And it's one that lawmakers and healthcare professionals are really grappling with right now.
So how?
If this bill becomes law, a whole new system would need to be established
What would it look like?
to handle these assisted dying requests.
Yeah.
It would involve developing clear protocols,
Okay.
training doctors and nurses,
Mm-hmm.
and setting up dedicated teams
Okay.
to oversee the process.
That's a big.
It's a massive undertaking.
Yeah.
It really is. And it would require careful planning and coordination.
What are some of the challenges?
Well, one major challenge would be ensuring equitable access
Okay.
to assisted dying services.
Okay.
Yeah.
Yeah.
need to make sure that these services are available
Everyone has
to all eligible patients.
equal access.
Exactly. Regardless of their location,
Right.
socioeconomic status,
Mm-hmm.
or type of illness.
Right.
It shouldn't become a privilege reserved for the wealthy
Right. Exactly.
or those living in certain areas.
Yeah. It's got to be fair.
It has to be fair
Across the board.
and accessible to everyone who meets the eligibility criteria.
Right.
That's really important.
What about mental health professionals? What role do they play?
Yeah, mental health professionals, they would play a vital role
Okay.
in ensuring that patients are making informed and voluntary decisions.
Right.
We need to have trained mental health professionals involved in evaluating patients' capacity to make these decisions
Okay.
and identifying any potential risk factors,
Like,
such as depression or coercion.
okay.
So they would be a really important part.
So it's not just
The safeguarding process.
it's not just about physical health.
Yeah.
It's about mental health as well.
Absolutely. It's about looking at the whole picture
Okay.
and making sure that the patient is truly making their own decision freely and with full understanding.
And what about doctors who don't want to participate?
Right. That's another issue that would need to be addressed.
Mm-hmm.
Conscientious objection from healthcare professionals.
Yeah.
Some doctors and nurses might have moral or religious objections to participating in assisted dying.
Mm-hmm.
And we'd need to have clear policies in place to respect their right to conscientious objection,
Okay.
while still ensuring that patients have access to the services they're seeking.
So it's about
It's a balancing act.
balancing those
Yeah.
two things.
Exactly. Balancing individual conscience with patient rights.
It's complicated.
It is. It's complicated, but it's something that we need to figure out
We do.
if we're going to move forward with this.
Yeah, this has been an incredible deep dive so far.
It has been a fascinating discussion.
It really has. We've explored the ethical, legal,
All the angles,
the practical considerations.
the nuances.
It's a multifaceted issue.
It is. It really is.
That's for sure.
But I want to end with one final question.
Okay.
If this bill passes and assisted dying becomes a legal option in England and Wales, do you think it will ultimately change the way we view death and dying as a society?
It's hard to say for sure.
Yeah,
It's a hypothetical question, right?
Right.
But it's an interesting one to ponder.
it is.
I think it has the potential to shift our perspectives,
Okay.
to make us more open and accepting of death as a natural part of life.
Okay.
For so long, death has been this taboo subject.
Yeah.
Something to be feared and avoided. But maybe by bringing it out into the open, by having these conversations,
Right.
by acknowledging that people have different choices and preferences
Yeah.
when it comes to end-of-life care.
Maybe we can start to break down some of that fear and stigma
Yeah,
and create a more compassionate and supportive environment
right.
for people who are dying.
That would be a good thing.
It would be. It
Yeah.
would be a positive step
I think so.
toward a more humane and understanding approach to death and dying.
And it's interesting because, like you said, this conversation,
Mhm.
it's happening across political ideologies.
It is, yeah. It's not a left or right issue.
Right.
It's a human issue.
Yeah,
It's
exactly.
something that touches all of us.
And religious beliefs.
Yeah, absolutely.
Yeah.
We see people from all different faiths
Mm-hmm.
wrestling with these questions
Right.
and coming to different conclusions.
Right.
But I think the important thing
Yeah.
is that we're having the conversation.
It's that we're having the conversation.
We're engaging in this dialogue,
Yeah.
and we're respecting each other's viewpoints,
And I think that's one of the
even if we disagree.
really important things about these deep dives that we do
I agree.
is that,
It's about fostering that critical thinking,
yeah,
encouraging people to think for themselves
and to,
and to consider different perspectives.
yeah, challenge those assumptions.
Challenge those assumptions.
Yeah.
Exactly. Because there are no easy answers here.
Right.
There's no right or wrong.
It's nuanced.
It's nuanced. It's complex.
It's messy.
And it requires us to really engage with these difficult questions.
Yeah.
and to listen to each other with empathy and understanding.
Okay, well, as we wrap up
Yeah.
this episode,
Mm-hmm.
I just want to encourage everyone listening
Yes.
to keep exploring this topic,
Absolutely.
to have those conversations
Talk to your loved one.
with your loved ones.
Think about your own beliefs.
Yeah.
About death and dying.
Because
And about what you would want
it's important.
for yourself
Yeah.
and for your family.
And I think that's what these deep dives are really all about.
I think so too.
It's about sparking those conversations.
Exactly. Sparking those conversations, encouraging people to think critically about these important issues that affect all of us.
Right. Well, thank you so much for joining us.
It's been a pleasure.
And until next time, keep diving deep.